Welcome to the Dental Marketing Podcast, a podcast that helps dentists win in the online world of modern-day marketing. Each week, we cover the most cutting-edge marketing tactics and strategies that are working right now across our client base to drive leads, phone calls, and more new patients for dentists. Now, here's your host and founder of Kickstart Dental Marketing, Chris Pistorius.
Hi, everyone. Welcome to the No BS Dental Marketing Podcast. I am your host, Chris Pistorius. And on this show, we talk about straight to the point, no BS tactics, tricks, and strategies to help you grow your practice. Now, there's no fluff here. It's just great content and information that you can start using today to increase your bottom line or help increase your bottom line. So if you're a dental practice owner, you're a manager, a front desk professional, or really whatever, be sure to click the subscribe button below so that you can keep up with all the latest tips and tricks. Now, today we have a very special guest. We have Dr. Heidi Smith from Heart of the City Dental in how do I want to say this? In very warm and humid Minnesota right now.
Yes.
April 5th is when we're shooting this, and I'm guessing it's a little chilly. Is that right, Dr. Smith?
It is. It's actually like 30 some degrees and really windy today. Yep. Lots of
Yeah.
snow. Third
Yeah.
snowiest winter ever.
When does it start getting warm there? I'm just curious.
Well, we do have a 70 in the forecast for next week. So
No
this
kidding.
is late though. We didn't hit 50 in March at all. And that was the first time in like 20 some years. So
Wow.
it's coming though. It's coming.
Yeah, it'll get there, right? Okay. Well, cool. Well, thanks so much for taking the time. I appreciate it. And maybe we could just start off by you introducing yourself and just telling us a little bit about your practice and how long you've been doing it and all that fun stuff.
Yeah. So I'm Heidi Smith. My practice is in Burnsville, Minnesota, and I grew up in the suburb next door, Apple Valley, Minnesota. So I did not fly far from home. I went to the University of Minnesota for undergrad and dental school as well. Graduated in 2003, and I've been at the same practice ever since. So my partner and I met in a water ski show, actually. We were both at a water ski show, and she was in dental school when we met, and I was going to be a pilot, and then I decided I wasn't going to be a pilot. So I was trying to figure out what I wanted to do. And her dad owned the practice. She was in dental school. So she's like, well, come check this out and see what you think. And yeah, the rest is history. So I started here when I graduated. I bought in 2007, and then we bought him out in 2010, and he retired in 2012. So it's just she and I, Dr. Tanya and I now.
Awesome.
Yeah.
That's a really cool story. So do you actually have a pilot's license or did you ever get one?
I don't. So my dad's a pilot,
Oh,
and
okay.
his suggestion was not to get a degree in aviation because if you end up not being able to fly, you have nothing to fall back on. So I got my degree and was going to go to flight school in Florida after I graduated from college, but I changed my mind before that.
Wow. It's really cool though. That's a good story. I think that's probably good advice too. I've never really thought of it that way. If you go to, aviation school, you better be an aviator, right?
Right. Right. I know.
Yeah, no kidding. All right. Well, cool. Well, let's get into it. I mean, a lot of my audience here, they're dentists, they're, front desk professionals, whatever, and they tune into this to, just gain from other people's experience in dental. And, obviously you've been doing this for a long time. You bought into the practice, I think you said in 2007, right?
Yeah.
Yeah. So you've been
Yeah.
not only a dentist, but you've been running a business, and there's,
Right.
definitely two different things there. Wouldn't you agree?
Yes, absolutely.
So the people that are listening to the show know that I always kind of go on my rant about it's great that you're a great dentist, but if you don't know how to run a business, like do hiring and HR, marketing, and all the other stuff you have to do for a business, might not go as well as you hoped it would. So maybe we
Right.
can start off there. What have you done over the years to learn the business side, and what tips or tricks would you give people that are, thinking of making that move and starting their own?
I guess I would definitely have some mentors. I mean, my partner's dad was a wonderful mentor for us, and we've used a lot of consultants along the way. And I know, people have different feelings on that, but we've kind of used different ones through different seasons of our practice. So, we've used some for growth. We used a different one when we were transitioning, through the retirement and him leaving. And now we're hoping to be dropping insurance hopefully soon. So we're, kind of working with specific people around that. But you need to have a really strong team around you, a great CPA, good marketing company. It's all about the team.
Yeah, totally agree. What's kind of going into rapid fire here, but what's one piece of advice you'd give somebody thinking about becoming a dentist in general?
In general.
So they're kind of in school, they're trying to, they're good at science, chemistry. That's kind of their major that they want to go into.
Right.
And they're thinking dentistry, what a veterinarian, what do I want to be?
Yeah. It is a great job. I mean, it's rare for dentists or dental professionals. I mean, most of our team, nobody works 5 days a week generally.
Yeah,
So it's a
sure.
pretty good gig that way. It's
Yeah.
pretty much an 8 to 5 job if you want it to be. I mean, you can be open nights and weekends, but we're not. So that I think, as a mom and a wife and all of those things, it's been a great career for me to have some balance in my life. But you have to be really driven. I mean, it's changed a lot even since I graduated 20 years ago. It's a different world out there now.
Yeah. And speaking of that, if you hit the reset button, let's say, and you had to do it all over again, was there anything you would do differently?
I would have done some more CE right away out of school. Like you get out of school and you're so done with school, you just
Yeah.
want to practice.
Yeah.
I wish I would have done a GPR or some, type of like 1 year residency. That's probably my only regret after school. And beyond that, I started at Spear Education probably in 2008, 2009-ish, but I would have started that earlier too, because you get out of school with just enough knowledge to do some dentistry, but there's so much more that you don't know as far
Yeah.
as treatment planning and, occlusion and so many things. So it's expensive. The CE is expensive. And, when you get out of school, you have all these loans
Yeah.
but it's super, super important. I would have started that a little earlier.
Yeah. No, that's good feedback for sure.
Are you looking to grow your practice but are a little unclear on what the best way is? Let us help you out. We have over 13 years of experience in helping practices just like yours increase new patient growth. Just go to kickstartdental.com and sign up for a free strategy session where we will give you some great insights on how to take your practice to the next level.
What do you think right now is the biggest challenge you're facing in your practice?
Staffing,
Really? Okay.
which I think is, across the board in a lot of different professions. Yeah. It's hard to find people. It's hard to keep people. I don't know. The workforce isn't like it used to be.
Yeah. So what are you doing to tackle that issue? How are you solving it for it?
Well, we've tried to get creative with our ads when we are hiring, and we're trying to just keep our team really happy, trying to, spread the love and know that they're appreciated. And I mean, we can't do any of this without them. So trying to keep everybody here and everybody happy.
Yeah. That totally makes sense. I wanted to ask you, I ask most of my dental guests, obviously hygienists and associates, things like that, you can't do this with, but when you're hiring like front desk staff, for instance, right? Admin type staff, do you prefer that they have experience in dentistry or are you really hiring on, just culture fit and personality first?
That is the age old question. We have tried both.
Hmm.
And I know people who have had great success in, finding a barista at Starbucks that has excellent,
Yeah.
customer service skills and all that, and have made them into great front office team members. We haven't been able to do that. So we do we do have in our ad that we require experience. There's a lot to learn in dentistry. So
Yeah.
to find the right person who's really driven to learn all of that and has the customer service, and that's a total package, but hard to find.
Yeah. So in your opinion, what do you think is the most important personality trait someone would need to work in this industry?
I think we have to be really, really kind and understanding and gentle. The whole dental community or profession has this persona of being scary and it hurts, and
Yeah.
so people stay away for those reasons. And then just picking up the phone to make the phone call gives people anxiety, walking in the door, so many things. So just have to be warm and welcoming and meet people where they're at.
Yeah, I think that's an interesting question. I was just about ready to ask, what do you think is a common myth about dentistry? So let's just, yeah, what do you think is the biggest myth in dentistry?
I think,
Mm.
I think that we're mean and we hurt people.
Yeah, right.
Every single day, people walk in and say, I hate you. Not you, personally, but I hate being here and all.
Right.
You don't take it personally. I get it.
Yeah.
But I think, there was a time when Novocaine wasn't widely used and, a lot of people did have some bad experiences. And of course, bad experiences are the only ones we talk about. So
Right.
there is a lot of dental anxiety out there for
Yeah.
sure. And yes, we do things that can hurt, but if you have adequate anesthesia and so many things, it can become. We have lots of patients that fall asleep, which is the ultimate compliment, right?
Oh, geez, that's awesome. Yeah. Yeah, I know it in my own personal experience. I had a root canal not that long ago. And, like root canals used to be like people freaked out over them.
Right.
And honestly, I didn't really feel the shot they gave me to numb me up was the most painful part of it. I mean,
Yes.
just like a little pinch,
Right.
I
Oh, it
was
should
like,
be.
he was done. And I was like, was that it?
That's it. I
So
know. I
that's
know. A
kind of,
lot of people will be like, "Did you give me the shot yet?" And I'm like, "Yeah, I'm done." Like, "Oh, I
yeah,
didn't feel it."
yeah,
So
absolutely.
that's the goal.
Yeah. What do you think are some underrated tools that are really indispensable for you in dentistry?
Well, the one thing that I think that every dentist has in their office, and we use it a little bit differently, is endo ice. So it's a dry ice in a can,
Hmm,
and every dentist uses it for testing teeth to see if the nerves are alive and healthy.
I
So,
see.
like for your root canal, for instance. But the way that we use it is to test if we have good anesthesia. So this is something that Dr. Bruce, who started the practice, had taught both Tanya and I to do. And you just spray it on a little piece of cotton and put it on their tooth. And if they feel the cold, then you need more. So it's
Sense?
such an easy thing to do and something that, like I said, everyone has in their office. But you can walk in and they'll say, "Oh yeah, my whole face is numb, ready to go." And then you put the drill on the tooth and they're like, so that's not a
Yeah,
good surprise for anybody.
absolutely. All right. Well, cool. What do you think is your biggest pet peeve in dentistry?
Well, I think the fact that people think that we're mean and are
Yeah.
going to hurt them.
Right.
That's one
It's
of the things. Another, I don't know if this is considered a pet peeve, but people think that dental insurance is insurance, and
right.
it certainly isn't. So that's a big hurdle to overcome.
Yeah, I hear you. That's one that we work on too. It's that, with dental insurance, most people don't realize it's only worth about, I say only, but it's worth about $1,500 a year, depending on what insurance you have. So,
Right.
in most people's case, it's not life-changing money, but they have this perception that, oh, well, you don't take my insurance. So,
Yes. Right.
so
Or
yeah,
my insurance doesn't cover it, then I don't need it. And your insurance is not looking out for your best interest. Let's
no,
all be clear on that.
no joke there.
Just
Oh,
because your insurance doesn't cover it doesn't mean that, it's not something you should do. So yeah, that insurance is a pet peeve for sure.
yeah. Okay. So we're kind of wrapping up here. I really do appreciate your time, but what's one question you wish I'd asked you and how would you have answered it?
What do you wish I would have asked? Or you would have asked? Oh, what I would do if I wasn't a dentist.
I thought you'd be a pilot. That's why I didn't ask.
Well, no, I was gonna be a pilot and then I changed my mind.
All right.
If
Okay.
I
What would
could
you
go
be if you
back
were a
and
dentist?
redo my whole life, no, in a different life, I would be a travel blogger. I love to travel.
Oh, that's
I've
right.
been to all
You've been to
7
all seven
continents.
continents. All right. Yeah.
Yes, and I like to write too, so I think that would be the perfect job.
I've got a job for you. We're always hiring writers here. So dentistry thing doesn't work out for you. Let me know.
There we go. Okay. You have to
Well,
send me
cool.
around the world though, and then I can
Uh,
write.
We'll have to negotiate that maybe. Well,
Just
Dr.
kidding.
Smith, thanks so much for taking the time. I know how busy you are. I'd love to be able, if possible, maybe follow up in a few months, see how things are going, and
Absolutely.
just get an update if that's cool.
Sounds good. We'd love to.
Well, thanks so much. And thanks to everybody for listening in today. And again, if you like today's episode, please do hit that subscribe button. We release a new episode like this almost every week to help busy dental professionals like you get the most out of your marketing strategy and other just business topics. So thanks again, and we'll see you on the next episode.
Thanks for joining us this week on the Dental Marketing Podcast. Make sure to visit our website, www.kickstartdental.com/podcast, where you can subscribe to the show in iTunes, Spotify, or via RSS, so you'll never miss a show. While you're at it, if you found value in the show, we'd appreciate a rating on iTunes. Or if you'd simply tell a friend about the show, that would help us out too. If you are ready to grow your practice, then you might want to schedule a free strategy session with us. Just go to kickstartdental.com and click the free strategy session button and give us 15 minutes of your time to change your practice forever. Be sure to tune in next week for our next episode. And thanks for listening to the Dental Marketing Podcast by Kickstart Dental Marketing, where dentists go to win online.